friends and colleagues. Welcome to our Lifestyle Medicine Clinical Practice Systems Introduction. This is essentially A&P 101 for Lifestyle Medicine Clinical Practice. Now, if you've not yet seen our introductory videos for each of the 4 systems, we will be inviting you to do that at the beginning of each of our sessions, getting into more in-depth training. I want you to have some foundation or context. We don't want to cover too much of what we've already covered. We do want to provide you with a bit of a framework or context or history from which these systems were derived. Number one, it's a fundamental belief in that a genuine holistic, with a W, meaning the whole thing, a genuine holistic approach is the best treatment approach. We want all our treatment options on the table. We want to understand the pros and cons, how they fit together, everything that is potentially good and helpful. That alongside of being very founded in reality, good science. How do we go about the process of figuring out truth, reality, from the woo-woo, the foo-foo, the distractions that don't actually help us understand or get the benefit that's possible? Now, there are several forces that particularly shaped the development of these systems, and I just want to share those with you. I spent many years leading out in the development of lifestyle medicine professionally. The American College of Lifestyle Medicine was kind of my baby for quite a few years, getting things going. I was one of the original founding members, and then secretary, then second president, first executive director, and so forth. So I've had a lot of exposure to lifestyle medicine over time, to the full scope, and played a significant role in helping shape it professionally, getting it onto a solid footing. This is both evidence-based and very clinically relevant and a holistic approach. Number two, I've been very involved in different models of care, different clinical contexts, from private practice to group practice to hospital employed, wellness center kinds of things. So I've had some pretty good exposure firsthand to different practice types and contexts. As well as that, I've also done a lot of just personal exploration of the full scope of healthcare, visiting all kinds of different providers, going to all kinds of different conferences, naturopaths, chiropractors, alternative medicine docs, and of course all the conventional medicine, just to really understand what is going on, what providers are experiencing, what patients are experiencing beyond the confines of the typical boxes. So I feel like I have a pretty decent understanding of that with the background of a master's in public health and epidemiology, originally thinking I was going to go into research and academics. And number 4, last but not least, really believing in and actively engaging and figuring out, how do we make patients the priority? How do we make this the kind of healthcare that I would want if I was the patient? How do we start with that functionally and then build out, not bolt on the patient perspective as an afterthought, which is healthcare today, as you may well know. So this is a set of systems, a set of tools to enable lifestyle medicine to function in the real world really, really well. To make it work, to make it flow, to get to the real important things, to make them easy, to make them tangible. This is not just a tweak on an old system. This is not just figuring out how to shoehorn lifestyle medicine into existing thought processes or frameworks or how we normally do things. That's important to understand. You may have to do some of that at different points in time in starting to do lifestyle medicine more and more in your individual context. That's not where these systems come from. We can't continue to do the baling wire, duct tape sorts of things to get to better healthcare. There's a point in time at which we have to completely reinvent. So these systems were essentially starting with a blank piece of paper and de novo from scratch saying, what should this be? How should this look? How should it function? And that creates a lot of opportunity to do things much, much better. Okay, a few other things. This is completely different clinically. Yes, there are similarities. Yes, we have to cover some of the typical things, but it's a different thought process. It's a different construct. There are different priorities. Just expect that. Be okay with that. There's a different focus. It's about causation, not just symptoms and downstream effects. There are different dynamics with patient prioritization. Things will look different. The process will happen different. Instead of just the typical, let's collect the billing data and the coding data and check all these boxes and all these quality metrics and all the stuff that makes us crazy and keeps us doing everything but focusing on the patient, which is what it's supposed to be all about. We have to pay attention to these other issues. We're not ignoring them. But let's get the focus, let's get the priorities where they need to be. Now, this is sort of a quantum leap in terms of interface. This is like moving from the old DOS computer language text screen to the modern GUI, the graphical user interface, like our smartphones or computers, where things are very visual. So just be expecting that. We want things to be visually appealing. We want it to be enjoyable to use our basic systems. And we need patience to easily engage with them if it is to actually be about patients. Now, like any well-designed system, like a really nice car, it can appear super simple on the surface. The interface should be simple if it's well refined and well thought out. And yet, it can be incredibly deep and rich and powerful, which is what these systems are as you understand them better and better. These are not static systems. These are living, breathing, progressive systems. They're pretty well refined at the point they are right now, but we will continue to expand, to add material, to explain different usages, different situations, scenarios, dynamics. They should become a means of genuine quality metrics, outcomes comparisons, the development of communities, research projects, and so forth. So these systems are the result of many years of a lot of blood and sweat and tears and experience, and we are very much hoping that they are of great benefit to you and to many, many patients. They have been a labor of love, and may they empower a far better future of healthcare for patients and providers and society.